Good evening. I'll let the last couple of people just trickle in and wanted to start on time, so we're not too late tonight. But welcome, everybody, and thank you so much for joining us at our 10th event. So this is the Stories of Health and Illness and event, and I'm Dr. Shannon Arntfield, and I'm so pleased to welcome you all, and so pleased that we've been doing this twice a year for 5 years now. The purpose of this event, for anybody who's new to it, is to listen, honor, and learn from those who have suffered illnesses, to bear witness to suffering, to inspire change in healthcare systems, to invoke healing relationships, and to inspire change. Tonight's event, and we've themed our events for some time now, tonight's event focuses on experiences of critical illness, and I want to give a big shout out to all the effort that went into the CCTC folks and the ICU folks at UH coming. Thank you very much. It's really, really nice to have you guys. And many of you will be familiar with some of our storytellers, and we have the privilege of 3 people: Martha McDougall, Serena Tejpar, Renee Robert and his partner Eve. And we also have with us Janet Taylor, who is our representative expert in critical illness, because as an obstetrician gynecologist, I have no expertise, unless you have preeclampsia. So, to anyone new for their first time, just the way this event unfolds, we sort of split it in half. There's a first portion of time spent listening to our patient storytellers, and the second portion of the event where we get to engage with one another and with our speakers, so that if you have questions, you can engage and ask them further about what has happened and what your area of overlap may be with their story. I always like acknowledging that the experience of listening and bearing witness is really challenging, and of course, as you probably appreciate, the experience of sharing is fairly vulnerable. And I just want to acknowledge that all the stories, there's a bunch of stories that will come up for each of us where it intersects with what we hear. And I want to acknowledge that for our speakers, they come with a great deal of courage. We as the organizing committee come with a great deal of humility, and I trust that all of you have come with a great deal of respect for what you might hear. So, I also, as a final comment, want to acknowledge that I'm, for one reason or another, have become the representative face of this event. But we have multiple partners and many faces you don't see when we all join up at the panel. And I'm not going to mention everybody by name, but I do want to mention our partners, and they include the London Public Library. Thank you for hosting us again. The Public Humanities at Western, the Schulich School of Medicine and Dentistry, the Office of Patient Experience at London Health Sciences, the School of Nursing at both Western and Fanshawe, as well as the Narrative Medicine Initiative and the sponsorship that we receive from the AMS Phoenix Project. So, without further delay, I want to introduce our first speaker, Martha McDougall.
Hi, everybody. Ooh. Okay. I am not a public speaker. So let me open with a disclaimer. Everything that I'm going to speak about this evening is my opinion. It is my story, and it is my feelings about something that happened to me. It may not make sense to everyone, as some days it barely makes sense to me, but I own it, and it is mine, and I think there is some power in that. I thank you all in advance for being here, in particular my husband, Mark, whom I love, and who already knows this story far too well. Hi, my son is also here and beautiful and perfect. Yes, Abel, Mark. So what happened to me did not happen for any real reason, and it has not transformed my life in any way that I would wish on any other person. If you asked me if I would trade my experience and what it has taught me, I would answer you without hesitation, without a doubt, take it away. Give it to someone who believes that everything happens for a reason. Give it to someone to whom it will bestow a greater understanding of life and the universe, or flush it down the toilet. I am very clear about certain things, and I want to make this clear to everybody here. Everything does not happen for a reason. I want to stomp my feet and scream this at all of you so you can understand how strongly I feel about it. And I don't say it to take away from people who do believe that. I can understand the desire to find meaning in something that's absolutely horrific. It's just not something I believe. Here's something else that should be evident, and I will make clear. I hate public speaking. I hate it almost as much as I hate what happened to me. When I was a child, my single mother very diligently ensured that I had everything my peers did, minus a father. I had years of piano lessons. Every year we signed me up for the end of year recital. Every year for 5 years. I waited until right before they called my name and then raced out of the auditorium in tears. Only in my final year did I eventually perform my piece. It's a true story, and it's irrational and it's weird, but apparently I'm not alone. So without further ado, and because I've put it off long enough, here's my story for what it is worth. On January 20th, 2013, when I was 30 years old and 37 weeks pregnant with my first and only child, I almost passed out in my kitchen. I was rushed by ambulance to Victoria Hospital. At this point, I have many lost hours, time I don't remember. I do remember being admitted. I remember a resident whom I recognized from a prenatal class we had both attended. The world is full of coincidence and connections, and I love this one. It's a good one. I remember this resident. I remember him being the first person to say the words blood clot. And then I remember right before my C-section, my emergency C-section, saying to the doctor before anesthesia, "Please don't let me die, and please don't let my baby die." A family friend later said, "Thank goodness they listened." Here's a technical précis of what happened to me directly from an article all about it. In this case, my case, ECMO was initiated through modified techniques with only the equipment available in a delivery room as a last resort to save a new mother after a significant downtime of 83 minutes. The patient received tissue plasminogen activator during the resuscitation, resulting in significant blood loss. However, the patient was stabilized on ECMO and after 5 weeks in the intensive care unit achieved complete physical and neurological recovery. The next thing I remember is not seeing anything but being able to hear. I remember hearing nurses conspiring to kill me with drugs. I remember hearing my best friend Julia talking to our other best friend Sonia about how they were both pregnant and both excited. I wasn't sure why they weren't telling me, but I was happy for them both. I knew my mother was there, and I knew my baby and my husband were not. After listening to several evil nurses talking about their desire to poison me by over-medication, and the fact that one of them had kidnapped my son, Abel, I felt an incredible amount of panic. How would I get Abel back? Where was Mark? Why wasn't my mother doing anything? Time went on, but I had little concept of it. Days and nights were not separate. I was there and I wasn't there all at once. At one point, my OB sent me to get a test done, and the nurse who had stolen my baby locked herself in a room with me. Dun, dun, dun. My OB and my mother were watching, begging and pleading with this nurse not to kill me. She didn't care. She injected oxygen into my blood. But I didn't die. The evil nurse had had her plan foiled, and she killed herself. Then the rest of the nurses on the hospital staff hated me. They took Mark hostage and left him in the trunk of a car at a Chinese restaurant. One of the nurses used some very anti-Semitic about my very WASP friend, Kim. They all hated me, the newspaper called, and I knew it was to ask me about the nurse's suicide. It almost sounds like a bad soap opera that you would never watch. Instead, I now know it's what's referred to as ICU psychosis. So my brain had been without oxygen, I was on copious amounts of drugs, and I had large gaps to fill. My brain did its best. In actual reality, I had suffered a massive pulmonary embolism during my C-section. This PE had blocked the oxygen trying to get to my heart and lungs. It is only because of the insane and inexplicable dedication of a group of doctors and interns and nurses and other staff who all came together to take a crazy chance on an incredibly long odd that I'm here today. That is it. There is nothing special about me. I am not a superhero. I am someone who has aspired to normalcy for her entire life. Something terrible, awful, disgusting happened to me, and this type of thing happens to a lot of people. The simplest way I can put it is like this. I had a worst case scenario, followed directly by a best case scenario. As mentioned in the journal article, my heart stopped beating for 83 minutes in total. I did not breathe, my heart did not beat for 83 minutes. It is insane, it does not make sense, but it happened, and I know because it happened to me. I have the journal articles, the hundreds of pages of medical reports, etc. That terrible thing happened, and then 47 days later, I walked out of the hospital all on my own. If this talk seems muddled, I apologize. That's how it is in my brain, that's how it gets conveyed to you. One of my most shameful moments was when a nurse asked me what I wanted most in the world, and I knew what I was supposed to say, what she wanted to hear. I was supposed to say that what I wanted and what I needed was to see my son in order to get better. Instead, I wept and spoke soundlessly around my trachea tube. Water. There is nothing more torturous than having an unquenchable, unslakable thirst and being given a moderately moist, teeny tiny sponge on a stick. I had been put in a medically induced coma for weeks and had undergone multiple surgeries. I think I counted 13 in total. People kept asking when I woke up if I needed my glasses. I did not wear glasses at the time. There are mirrors around the lighting in ICU, and I kept seeing crows in the ceiling and thinking, at the very least, this is unsanitary, but give me more drugs, please. It turns out I was seeing my mother's black Roots boots because she was there every day. More than likely, this is the part where I will fall apart, but I would like to tell you a little bit about my mother. She found out when she was pregnant with me that my father had malignant melanoma and he was gonna die. He did die when I was 8 months old. My mother went back to law school when she was 35 and I was 5. She is hyper intelligent and hyper protective of me. While my husband Mark cared for our newborn son on his own in our own home, my mother moved into the hospital. Literally. She had someone find her an empty room, and when she wasn't with me, she slept there. She was by my side all the time. And when I woke up, my primary care nurse has said to me, "Your mother just kept saying to us, 'I can't wait for you all to meet Martha. You're going to love her.'" So that is my mother. She and Mark and Abel are my favorite people in the world. As time went on, I became more able to delineate between reality and fantasy. I knew I had a son. I never wavered on that. His picture was on my IV pole, and I knew that picture was Abel. But I also knew something really wrong had happened. I didn't know a blood clot from a donut. So I think the first thing I asked my mother was, did I have a heart attack? I had to be told, I'm sure several times, that I had experienced a blood clot. I now know that I had that group of young doctors and residents, etc., working on me nonstop, from the time my heart stopped to the time I was connected to ECMO. I have confirmed with one of these docs that my heart was not going to restart on its own. It needed the ECMO. To this group, I ascribe my survival of that last night. There's one person in particular, who I will not name, but his name rhymes with Baruch Banshee, who was in charge of making the decision to not stop CPR. He owns a part of my heart forever. When I told him that, he said, "Why not the whole thing?" He is handsome and humble, and I owe him above all the others my life. I should explain more about ECMO. It's a machine that essentially circulates your blood for you. I believe it's typically used in bypass heart surgery, but it's sometimes used in emergency situations like mine. I lost so much blood and required so much new blood that I've been told that the OPP had to bring more in from surrounding communities. Most of my surgeries were attempts to stop internal bleeding. One was to save my arm from compartment syndrome, inadvertently caused when the ECMO pumped too much blood into it. I lost my spleen, another piece of information I was given several times and cried every time. I did nothing to deserve what happened to me, and I also did nothing to deserve the amazing attention and care that I received. I would cite what happened as an example of what can happen when our health system is working at optimal efficiency. For a long period of time, my family believed I would not survive, or I would be brain damaged, or I would need years of physical therapy. And I will take this moment to remind you, I walked out of the hospital 47 days after the initial event. Here are some other things that I have trouble reconciling. I'm not proud of them. I realize they may sound like real nitpicking, but I'm a human person and I'd like to acknowledge them here. First, so far as I can tell, I will never not be angry about missing so much time with my son. I met him when he was 1 month old, and even when I went home, I still had gaping wounds on my abdomen that were not completely healed. I could not breastfeed, I could not carry him around the house, I could not go to the bathroom, I could not go up and down my own stairs. We watched a lot of Deadwood and The Wire. Apparently I will continue to cry every time I have to talk about this, but not so bad tonight. 3, I miss my spleen. Do not take your spleen for granted. I hate that I have to take blood thinners for the rest of my life. And I have to accept the fact that while now my nurses and doctors like or even love me, they had no knowledge of who I was when I was a meat slab on a table. I was a guinea pig. They are scientists. This is what they do. I am lucky that they experimented on me, excuse me, because the alternative is that I would be dead. I don't list these things to tell you about all the ways I feel that life has failed me, but more to make you all aware that I am not an exceptionally well-adjusted person, and what happened definitely did not make me a better person. All of that being said, there is no part of me that is not 100% grateful for everything that was done for me. It is hugely important to me that my doctors and nurses know how deep my gratitude runs. So every year I write a letter to the people I've stayed in touch with, and I thank them from the bottom of my heart, which they saved. Is it hard for me to do? Absolutely. I cry, I weep, I have even been known to drive around in my car screaming at full volume. The more time, though, that grows between the actual event and the here and now, the better I am at controlling my fear, anger, sadness. But I cannot say that the day my son was born was the happiest day of my life, nor can my husband, nor can my mother. But at the end of the day, none of that matters, does it? Because I'm here. I'm alive, my family is here, we made it out of a worst case scenario with our lives and family intact. So, quickly before I conclude, I want to leave you with the following thoughts. If you can, please give blood. Please be kind to everybody and tell everyone that you love how much you love them, that they make your heart explode when you think about them. Enjoy your time here, because despite all of its flaws and the fact that, yeah, I wish vampires were real and we could all live forever, I know that life is short. And even if you make it to the ripe old age of 99, there's always more you want to do. So do it now. Try to live without fear. Easier said than done, I know. And be true to what you believe. Unless, like, you believe in white supremacy. One thing all 3 of us on this panel have in common, I think, is a very strong support system. So support those you love. Lift them up, give them all your care. Always thank people who save your life. And don't sell yourself short. You're capable of things you never would have imagined. I think everyone up here would agree. Did that sound preachy? A little bit like something that a life coach might say? Such is life. So in closing, how does this connect to narrative medicine? You guys can figure that part out. For me, I'm choosing to share my story to remove some of the fear it still creates in me. I'm also sharing it for the training of future healthcare providers. Also, just for the sake of my vanity and because it inexplicably matters to me, never forget that I, Martha Jane McDougall, hold the record at Victoria Hospital for the person to have had the longest consecutive downtime to then get up and leave the hospital relatively unscathed. Thank you and good night.
There are a lot of people in the room that know Martha, and for all of you and for anybody who didn't know Martha, I do this every time because it's important, at the very least to me, to have a minute before we transition. But I just want to take a second and just acknowledge everything we just heard. And Martha, you just did an incredible job at the black and the white of all of this. Thank you. I'll just take a second. The second is not over. Okay, so I'm going to do that after each of the speakers, and just so that you know that it's coming, there's going to be a minute where you can just reflect, even in a minute way, before we go on, and it's partly to honor the person who's just spoken, but it's partly to honor everything that's come up for you while you've been listening. If you are writing notes or you want to ask a question later, it's a minute to think about that. So I'll do that between everything, between each of the speakers tonight. But thank you, and our next speaker is Serena Tejpar. I'll bring her up now.
My name is Serena Tejpar, and I'm a third-year undergraduate medical sciences student from Calgary, Alberta, who studies at the University of Western Ontario. About a year and a half ago, I was injured in a car collision that left me in critical condition with almost no chance of survival. I was the backseat passenger in a car heading to Toronto when we were T-boned by another vehicle. Despite wearing a seatbelt, the collision left me unconscious with a sheared aorta, collapsed lungs, broken pelvis and sacrum, torn bladder, subdural hematoma, subarachnoid bleeding, and bruised liver, pancreas, and spleen. When I didn't arrive in Toronto, my parents, who live in Calgary, called around to try and find me. After finally getting a hold of another person in the car, they called the hospital, only to find out that their then 18-year-old daughter was in critical care. The doctors told them that by the time they would get to London, it might be too late. And I know conversations like these are far from easy for doctors to make, especially over the phone. But my parents are so thankful for the way that they told them, with nothing but honesty, kindness, and compassion. When my family arrived, not only was I being looked after, but a whole team came to comfort my family. They were provided with a room to grieve, to cry, and to offer each other comfort. My parents told me that over 40 doctors and nurses fought to keep me alive that night. They handbagged me for 4 hours on rotation to make sure that oxygen was getting to my brain. And my family was told that even if I did make it, I wouldn't be able to go back to school, let alone function enough to play tic-tac-toe because of the severe brain damage. But despite knowing my injuries and prognosis, the team did not give up. After having 2 cardiac arrests, one doctor in particular made a tactical decision to give me a fighting chance. He decided to put me on the ECMO machine, a form of life support that put me in an induced coma and functions as my lungs outside of my body. I was supposed to be on this machine for 2 weeks, but I was only on it for 5 days. The doctors later told me that this is when they saw my will to live. And I've seen pictures of me in a coma. And as unrecognizable as it is, and as hard as it is to look at, there's one thing that I won't forget. In it, my hair was braided and put in a bow. This may have been a very small gesture, but for my family, it meant that I was being cared for as a person, and not just as a bed or patient number. In such a traumatic time, it was the little things that gave my family hope and happiness. The medical team showed immense sensitivity and compassion in the conversations that they had with my family, and in being available whenever they had questions. After being in a coma for about a month, I woke up confused to see my immediate family around me. It took me some time to overcome the panic of being connected to so many tubes and machines, and finally realize where I was. I also couldn't communicate this fear because of the tracheostomy in my throat. In this state of complete confusion and paralyzing fear, I faced many challenges. One of them was in trying to communicate and understand what had happened. I was first given a whiteboard, and I found that even picking up a pen was difficult because my muscles had atrophied. Then, I was given an iPad that could communicate only simple statements and needs. But I had so many questions, and it wasn't enough. Even then, the nurses stood by my side and advocated for me, for my privacy and my dignity. There was one situation in particular when the curtains were closed and I was changing, and a male resident just walked in. The nurses, furious, as if their own privacy had been violated, confronted the resident afterwards. They were my voice when I didn't have one. And despite the many challenges, I was determined to get better, to get all of the tubes out and disconnect myself from all of the machines, to learn to walk again, and to regain my strength. I received support from my family and the nurses and residents who pushed me and wouldn't let me give up. I realized then that I had a family in the critical care team. I remember when the team was getting me ready to eat solid food for the first time since the accident. I was craving the greasiest pizza. Within an hour, all of critical care knew, including the residents and the support staff. And there were so many people gathering in and around my room to celebrate my progress. Although the care that I received greatly benefited me and touched the hearts of my family, I couldn't perceive or recognize it at the time. But now, these memories are the little moments that put a smile on my face and give me strength, despite the suffering I went through and still continue to go through They are all reminders to keep fighting. Although it has been about 1.5 years since the accident, my journey has just begun. This recovery hasn't been easy with the daily emotional and physical struggles. But I know that I'm incredibly lucky to be here today. And on top of that, to have such a huge support system in my physicians, nurses, the support staff, and other rehabilitation staff. Whenever I drop by to visit critical care, I'm greeted with familiar smiling faces that make me feel comfortable and safe. I'm asked about my hopes and dreams, and I'm treated as family. What the medical professionals do on a daily basis, and the empathy, genuine personal care, and compassion they demonstrated and still demonstrate inspires me. It inspires me to continue to work to achieve my goals despite the challenges. And just like they have impacted me, their compassion and care is what I wish to emulate in my interactions with others. They have further inspired me to pursue a career in medicine, to be able to show that same care and empathy to my own patients in the future. Thank you.
It's so hard to come up here. It's amazing. Every single time we hold this event, it's amazing what gets shared, and thank you, Serena, so much. Let's take our minute. It's only long enough when it's become uncomfortable. Okay, so our last speaker is Renee Robert, and I think he's coming up with his partner Eve. Yeah, they're gonna come together.
Thanks for the intro. Good evening. My name is Renee, and this is Eve, my partner of 23 years now. Or a little more than that, I should say. First off, thank you everyone for coming here tonight, for being here. A little bit about me, my background. I was in the military for 30 years. I'm a military pilot, jet pilot by career. After that, I worked another 8 years in the aerospace industry. And about me as well, I love running. I used to run marathons, tried to keep in shape. Unfortunately, this is something from the past now. I've never smoked, I remember that. Never did drugs. I'm a light drinker. I take a glass of wine with dinner once in a while. Now here's a question for you. Do I look like someone who spent 10 months in the hospital? 9.5 of them were at the ICU. And that's not easy. On life support, obviously. I want to start by saying that thank you to all the healthcare system, healthcare team, and Eve for being alive as I nearly died during that period. Eve was at my bedside during those 10 months. He traveled between Toronto, London, and Lucan, where we live, between hospital, work, and house. At one point, here in University Hospital, Eve was asked nicely, and I appreciate this, and someone here will recognize this. Eve was asked to take a break, and he went away for 1 week. During those 10 months, he was away for 1 week. And if he wouldn't have done that, he would probably have found himself next to me in a bed too. I'm going to tell you about my illness, and I want you to know that I had never been sick before. The root cause of my illness was never identified, and that's something that I wish I would have been able to find out what caused it. In the summer of 2012, Eve brought me to the hospital. I was admitted, and almost right away went into the ICU. I was initially diagnosed with pneumonia, and then they did all the tests, obviously. And doctors, when they saw my chest x-ray, they all thought I was a heavy smoker. I had never smoked in my life. I had to be put on the ventilator, obviously. They intubed me, which with me was not working very good. I was fighting the ventilator. And shortly after that, they decided that they had to put me into an induced coma. I was into an induced coma for about 8 months. During that period as well, they diagnosed me with ARDS. ARDS is acute respiratory distress syndrome, as the lungs are filling then with liquid. And it's like drowning on dry land. So to remove the liquid, they had to, all the fluids in my lungs, they installed 4 drain tubes during that period. And also, while I was still in the coma, they couldn't keep me in tube for too long of a period of time. That's when they installed my trachea. Obviously, with the trachea, when I woke up out of the coma, which was not a quick waking up call, I realized that I could not talk. And in a situation like this, being able to speak, to be able to communicate with people is very important. My hospital stay was split between Sunnybrook for 5 months and UH here for 5 months. And like I said, in total, on those 10 months, 9.5 were at the ICU. During the first 5 months, I had various infections. I had pneumothorax and other infections that they had to treat. I developed a coccyx ulcer. I lost weight. From 130 pounds, I went down to about 85, 86 pounds. My lean body mass was then assessed at around 51%. And that's at the point where there's a risk of vital organ to shut down. Being under heavy sedation as well, with all the drugs that I was getting for pain and all the other medication. I came at a point where I was also unable to focus. I would see 2 images, and I would see double, and so I could not even pinpoint where I could look. Having lost all that body mass also caused me to get very weak. I could not even hold a pen or a pencil to write on the paper. After the first 5 months at Sunnybrook, I was then transferred to the University Hospital here in London. The change of approach that the medical team here had for me and for my treatment turned out to be a life-saving change of approach. First, they wanted me to regain some weight and body mass. And to effect this change, a drastic approach was suggested by one of the physicians, but required the approval of Health Canada. The proposed treatment was to put me on anabolic steroid while monitoring my liver function. The aim was to reverse course from the catabolic state that I was into to an anabolic state where my body would start regaining strength. Following that, they would wean me from the painkiller, wean me from the ventilator, get me back on my feet to return to a normal life in order to eventually leave the hospital without any life support equipment. That was not without challenge, and communication, like I said, was a big one with them. You have to realize here that being totally dependent on all the staff for your health, the simplest recognition that you're working with all of them to get back on your feet and having them praise you for the slightest gain has a tremendous positive impact. A small but very significant anecdote here. How many times did I hear from the staff, "Good morning, you look good this morning. Do you have a good night's sleep?" And all that with a smile. That made me feel good, even on the days that I did not feel so great. It was nice to hear. It was positive. Communication, being verbal, nonverbal, body language, written, were somewhat of an issue. How do I communicate clearly with everyone when I cannot speak? I must say that I quickly realized that I became more observant of all communications. The tone of voice, the body language, all contributed to tell me how I was doing. I could feel the fears and despair. Sometimes I could even see discrepancies from what was said and the body language that they were showing me. Every day, it would be there to be my communication link with all the medical staff. As for the written communication, imagine this. You're so weak, you cannot even hold a pen. Then how do you communicate? You've got to be resourceful, you've got to be thinking. Well, I took my hand and I was drawing letters like this, and he would write each letter to form words. And sometimes, the most frustrating thing, is you're halfway through writing a word and then you forget what you're trying to write. Yes, it has happened quite a few times. You just feel so helpless and you get angry at times. And I hope I didn't get too angry for the staff there. I hope they're not too mad at me. And then when I got enough strength to write again, then the issue is it legible? I was trying to write and my letters were atrocious. We kept pages of papers that I looked at, I couldn't even read myself again. What I would like you to remember is for a patient like I was in my case for a very long time, is small things don't go unnoticed and they're appreciated. Do not assume a patient or a family who's out there sometimes is not hearing you. Even if you appear asleep or something like this, be mindful of your body language. It could be a dead giveaway. Take the time, if possible, with a patient who needs to write response or questions. One thing I want to say about the entire staff is you're like second family to a patient, and we're working as a team to achieve a goal. Patient and family want to understand what is happening and why, and be part of the team's decisions. After 10 months, it was enough that they decided that, yes, we're going to kick you out of the hospital. That was not the end of it, obviously. I kept on coming for my cottage ulcer at the hospital for the wound care specialist nurse for 3 years after that. I needed surgery to close my trachea. I said it wouldn't close because it was open for too long. When I got home, obviously, I had some home care that became at a house for me. I would come back for a test, for pulmonary function test, which were performed at the outpatient clinic. As I said before, look at me now. Would you be able to tell? From 85 pounds, approximately 40 kilos, I regained my muscle mass. I'm now around 125 pounds, 57 kilos for those that speak kilos. I can walk as I could before. I even do walks now about 3 to 5 kilometers a day with our dog. It's a little Malamute. Something I could not do at all before I went to the hospital. So that you know, Eve is the one who recognized I was getting down. I didn't even recognize it myself. Without Eve and the entire medical staff, I would not be here today. Thank you all. The tremendous work done by all the people in the healthcare system made it possible for me to be here on my feet. I owe them all my life. I've got a small anecdote here. One day in my room, the physiotherapist came in and was talking with the nurse, and they were discussing when they expected me to be off the ventilator. I could hear them. I did not say anything. But I was saying internally to myself, I will beat those odds. And I did. And I could talk again. Think about this for a moment. It's remarkable to me that over 8.5 months without saying a single word, then one day, the RT specialist came in the room. He had waited for Eve to be there, disconnected me from the ventilator, plugged my trachea, and jokingly said, "Go ahead, you have 15 minutes to talk." And I could. Thank you for being here with me on that one. My voice had not changed. And when I came and I started talking, some of the staff were hearing this strange voice in the room, came by to see who it was. They had never heard me before. It was me. I was going to make it through. Again, to all the people who care for me, I cannot say thank you enough. I owe them my life. Thank you all.
Thank you, Renee, and thank you, Eve. We're going to take one more minute. So I want to take a minute before we open things up to the audience to just say thank you to all our speakers again. And we have a bit of a special audience who try to organize themselves from both the ICUs. And I actually just want to take a minute to recognize you guys too, because I have a little bit of knowledge because of my husband who works in the ICU. But this is not the most common event in your unit. It's the hoped for event with all the patients there, but it's not the most common event. And I just want to acknowledge that this is what you fight for every day. So thank you to all the people that are here. And on the same note, I want to thank Janet very, very much, who's a senior nurse in the CCTC who came to support our panel and to support me and to support all of you in the questions you may have. We have tried to have a panel expert every event because sometimes the questions you guys ask relate a lot more to system-based issues than to the personal experience that someone has had, and we didn't want the speakers to be left responsible for trying to answer stuff like that. So that's why Janet's here, and thank you to her. And I want to invite people to ask questions, but I will ask you please to pause. When you have a question, someone on each aisle will be watching for you. They have a mic. Whoever's closest to you will get to you. Please, please, please wait for the mic so that we can actually hear your question. It always takes a minute, it's fine.
So this is an open question. I think any one of you would be able to answer it. It's just whoever is willing to. All of your stories had a big theme of sort of this sense of loss of voice. And I was wondering if you could speak a little bit more to a time during your time in the ICU when you were really frustrated and there was something you really wanted to say, but you weren't able to.
Hello? Yeah. So despite my terror at public speaking, I love speaking in general with people that I love. And you have a lot of questions. It's like an insane amount of questions. So the whole experience is ridiculously frustrating. My favorite story was when I couldn't speak, and I don't know this is just the right answer, but it's a really good story. Trust me. I was nonverbal, and because of the fasciotomy on my writing hand, I couldn't even do writing stuff. And my very sweet, loving husband, printed out pictures for me to point at, and that didn't work. And a nurse was being very chipper about the whole thing, which is great and has its place. And I could barely, it wasn't Janet. I could barely move my fasciotomy arm. And I'm not sure if my eyes were open all the time at that point, but very gently was able to move my hand so that I was giving the middle finger. And my husband burst into tears because he said that was when he knew I was still in there. So that's my favorite.
Yes, the communication was always a problem when he was at ICU, because we always communicate at home, and suddenly he couldn't even hold a pen to write or even draw the letters. So I had to come with some imagination to be able for him to communicate when he was in pain, when he was tired, or when he had to be clean. So on a piece of paper I wrote keywords, and he could point out in each case what he needed. Also, to call the nurses, instead of finding this bell always lost in the sheets in the bed, I came up with a pet toy, and he was squeezing a little boot, like a cowboy boot, and he was squeezing this boot when he needed the nurse to come. And because of the noise of the squeeze was different than all the other noise from the monitors, immediately they rushed, and they could recognize that he needed to be taken care. And then, especially when the trachea was removed, it was a big relief. Because also I learned, we tried the iPad, we tried everything. Because of the painkillers, his vision was double, so he couldn't point out any, he couldn't write on the iPad. I tried the alphabet, he couldn't point out the letter. So only with patient, and yeah, it was very, very frustrating for him, and also for me, and for the nurses. So in that case, you have to be very patient and wait until, because it was up and down. Sometimes he could write and he was communicating even clearly, but some of the parts was very hard to understand what he wanted to say. Especially, I don't know if he wanted to speak in English, in French, so it was challenging. And yeah, so I think we always communicate, and sometimes we think the same thing at the same time, but it didn't work that time. Telepathy didn't work.
So I think for me, earlier on, so once I was out of the coma, I was just really confused and lost, and it would really bother me when my family would go home at night. So I think that was like difficult in trying to communicate. So like it'd be like the middle of the night, trying to get like the nurse's attention, just trying to ask questions about like where they went, when they'd come back, even earlier in the mornings, when I'd be woken up for x-rays, and then having to just lie there by myself, waiting for family to come. That was really difficult. Yeah, and you didn't even have the strength to like try to get people's attention, so I would try like knocking on like the side panels of the bed, but just didn't have enough strength to make a sound. And then for my family, specifically my brother, I communicated with like really attitude eyes, so that's how I communicated with him, but like with the doctors, like that was quite difficult.
Such an appreciative crowd. Or they're very exceptional, Martha says. Is there any other questions?
It's not really a question. I just wanted to compliment you all for the tremendous courage you have shown. And obviously, your miracles and I'm not being religious here. Particularly, Serena, you had said, when you spoke about the destructiveness that was done to your body, I'm amazed that you're alive. So it's not really a question. I'm just glad you're here.
Hi, thank you guys very much for speaking tonight. I think you guys did a wonderful job. If there was one thing that you think would have helped you along your journey of getting better that could have been done, the one thing that you really just like wish had been different, what would that be for each of you?
There's, you know, with 10 months in the hospital, there's so many things that we could talk about here. But for me, I've got to say this. I think they all did a tremendous job. And especially when I got conscious enough, like when I was in Sunnybrook, I must admit, there's a lot of stuff, because of all the medication they were giving me, I'm not into drugs, and I don't, you know, like, to me, that was perhaps a little too much. Because you're not as conscious as you could be, and sometimes you wish you'd be able to react a little better. But out here, when I got to UH, they were trying to wean me off those drugs, and then when I got conscious enough to be able to realize exactly everything that was going around me, I found that they were so helpful in most cases that I don't think there's anything else I could have asked them to do to improve on what they were doing. Like I said, they saved my life. There's no doubt there in my mind. So to them, I say, thank you. That's a job well done. Yeah, to all the medical staff. Yeah.
I think for me, the most important thing was having a great support system. People that could be there to carry you through the struggles, to cheer for you through all your progresses. And I think that I was spoiled in the care and love that I received. And I think that that was essential for my care. And I don't think that it could have been any better. Like, I truly feel like I was spoiled in critical care.
I 100% agree with that. People love a happy ending, and people love a long, odd story. And I don't know if you had this, but I remember people coming into my room and being like, man, I was there when it happened, and I can't believe it. You're here. Yeah. So if I had to nitpick, there are no clocks in CCTU. Yeah, or walls, guys. There's cloth curtains, so some walls. Anyway, clocks. Get some clocks, or get your mother to buy you a Indiglo watch.
Me, I would like to add, because I was the family and I was there almost every day. And when Renee had to add some blood work or even the dressing, he was having a vacuum dressing. Sometimes the nurse was not comfortable doing the procedure. So there was a special nurse dedicated only to do the blood work, and that was very efficient. I mean, the nurse in charge, if she was not doing blood work every day, she was kind of fighting sometimes, but having a nurse only dedicating of blood works in the hospital was very useful and was not painful at all for Renee. Same for vacuum dressing. You don't do that every day on any patient. So sometimes you lose the practice. You might have learned that at school. And having a wound nurse dedicated to that and teaching to the other nurses or reminding them how to do it was very useful. At one point, the poor Renee was laying in his bed like a mummy, full of plastic and stuff. So I decided to take pictures of the procedure when the wound nurse came and put that in the binder like that. Later on, the other nurses could refer to the document and do it correctly. But most of the time, I have to say they were very, very professional. And for me, they became like a family because I could talk with them every day and learn from there. And I wanted to participate too to the daily procedure, and I learned quite a lot.
Just to head up on what Eve just said there about this vacuum dressing. He came that night where it was a particularly difficult one that day, and it was leaking. They couldn't get the proper vacuum. And Eve came in that night, and he saw me. He said, "You look like a mummy." That's how much tape there was on me at that point. So that was a little bit of a joke. What Eve said is obviously if you haven't done this vacuum dressing for a long time, and you're not that proficient with it, then maybe it's worth it to ask for some help sometimes. But that's an isolated incident. I mean, in this case, that was kind of funny at the end. Like, we can laugh about it now.
Hi, again, thank you for sharing your stories. Really important to hear, and thank you for sharing. My question is about, being in the ICU, it's very complex patients, obviously, so many lines going in you, as a few of you said. I imagine there's kind of a lot lost in communication between the medical staff and the patients, and in terms of being able to explain all of the issues that are going on and all of the treatments that are going on. So I was wondering if there's any comment that you could offer on how involved you felt in your care, or how much was being done without, how much of your care you were involved in, and how much was being done, and how much control you had, and what your experience was kind of being in that situation.
I'm going to start, and then I'm just going to pass it on. To answer your question there, to me, when I got, like I said, it took me a while before I can be off the drugs enough to think clearly in all those cases. But when I did, all the nurses or doctors, they would come in, they would talk to me about the treatment, what they were trying to do, how they were going to achieve it. And that in that respect, I mean, like, the communication was very good. The drawback, obviously, like I said, is I was 8.5 months without talking. I had to write down my answers, and that takes some time, and sometimes they don't really have all the time that they would like to spend with you. And but other than that, I mean, like, it was excellent. To me, it was very good.
So for most of the time, I was like unconscious, and when I was conscious, I wasn't really there. So my mom was a nurse, so she was greatly involved with figuring out what was going on and the procedures that were happening. So she was very involved in that. And then when I came kind of to, all of the specialists would come in and tell me to take this machine out or this tube out. You'd have to do this, this, this. And I was like, bring it on. So that's what I did. I was like, what's next? Like, how can I get this out? So even though I couldn't communicate, when I came to, and I learned about how to get the machines out, I was involved in that part.
Yeah. When you're in CCTU or an ICU, I don't know if you know this, you get a primary care nurse and they sit at the foot of your bed for a 12-hour shift. So someone's with you 24 hours a day, which is insane and amazing. And there's a reason Janet is everybody's favorite, because she's really good at reading lips. And there was a day, it's a teaching hospital, right? And that's great, that's how it should be. People should learn from your experience. But there was a day, I don't know if you remember this, Janet, there were a group of residents, yeah, and they were at the foot of my bed, and I was across from this guy named Mr. Muhammad, and he was tied down, and oh man, it was weird, but they were sort of in a cluster, and they're, oh well, I don't know none of this, and there were a lot of clipboards, and there were a lot of big words, and I was medicated, and Janet went, hey, this is Martha McDougall, and she thinks you're talking about her, and one of you needs to tell her what's happening with her. And so a really tall resident came over and explained it. And then there are just people who sort of take an interest in you, maybe because they can't believe what happened, or they were a big part of what did happen. And those people come and check in on you regularly. And like if they have to take notes, they'll do it at the foot of your bed and sort of like, here's a little anecdote about me, or I feel like I got off topic. I don't feel like I was very involved in my own care. I was very spaced out of my gourd. And unlike Renee, sorry, I loved the drugs. There's a PICC line that goes, yeah, laugh it up. But honestly, if you're in a hospital and you're terrified, and there's a tube that takes something a lot like heroin directly to your heart, you're gonna want to take advantage of that, because it's terrifying otherwise. So yeah, I didn't feel super involved in my own care, but it was really great to have people advocating for me, like Janet.
Well, you've kind of already touched on what I was going to ask, but Martha, if you don't think you were spoiled, which I'm sure you do, one day you, the nurse that was taking care of you was called away to go admit another patient, so I had to finish painting your toenails. So, so maybe a little spoiled. Anyway, my question is about the drugs. I'm wondering, you know, we see you, and obviously we're infusing the pain medicines. I'm wondering about, once you leave the ICU, what happened then? Did you go to oral meds? Did you leave the hospital needing the medications? Were you foggy? How did that, and how long did it last?
So even though I loved the drugs when I needed them, I've had a drug phobia my entire life. I don't even think I took Tylenol for years. So I believe that I got moved up to general surgery for the last bit of my stay, and they put something in called a butterfly, and it stings when they put your pain meds in there, so it's not the same. And then they take your PICC line out, and then they put you on pills, and the pills, I mean, are fine, but I was in a really big hurry to get off of them. As soon as I got home, like I kept a journal, and I think within like a month and a half, I was off of meds. Probably less than that. Like I really tapered them way, way, way down, and then was off of them entirely, because they upset your stomach, and they're just unpleasant. I'm like that pig line.
So I don't really remember what medication I was on once I moved down to the step-down unit and onto the floor. But when I went back to Calgary, because my mom's a nurse, she made me stop taking all of the painkillers. So I was only on Tylenol extra strength, and I had blood pressure medication as well as the blood thinners and aspirin. But I've never really been a pill person, so just like her, like I wouldn't take Tylenol. But like I couldn't tell the difference. So Tylenol extra strength was great when I needed it. Yeah.
I've got to say this about the drugs. To me, there was two effects that I would see from the drug. One particular drug that I was given when they were doing my vacuum dressing change, for instance, would last just like a short period of time. And that's, I don't know if I can say the name. It's hydromorph that they were giving me at the time. And it's such a very short duration. And so that was fine with me because it was just really getting rid of the pain when they were doing the procedure. But some of the other medication that I was receiving sometimes would just leave me drowsy and just leave me not like really myself. That's what I did not like. I just don't like that feeling. I guess I like to be in control of myself. Sorry.
Hi guys, thanks for sharing your story. We're learning a lot more about the family side of critical illness, and in particular the stress and the trauma that it inflicts upon the loved ones. We sometimes see return visits to the ICU, and we actually see the family greatly affected by even being in the building again, and in a way that I think obviously reflects the degree of trauma they experience. To say nothing, of course, of the immense trauma you experience, but there's a purposefulness and a different story being told effectively through your own journey. And I was wondering if you could comment, and obviously Eve, you're able to comment directly, but also Serena and Martha, comment maybe if you feel comfortable on the shared experience of your family or Mark and others, and how, it's obviously a great story of celebration for all of you, but there's a significant backstory there as well. Would you mind commenting more on that?
Yeah, I still love to go back to the hospital because it's kind of like, what up, I'm a rock star, it's awesome, you guys saved my life and I love you. And like, not to take away from the fact that I definitely have PTSD of some form from it. I think that Mark has it as well. He's gone home, so I can say that. But it's true. He and my mother will not go back to Victoria Hospital. I think my mother, when she comes into town from Burlington, will like avoid Wellington. For them, it's a big deal. And my mother recently had actually it wasn't that recently, but a couple months ago, she had to have a hip replacement, and they gave her at the Welland Clinic in Toronto. It's like they only do whatever bone surgery is called, osteo. Anyway, and she sort of did not prepare herself for how terrified she would be of the hospital. And I wasn't there, her husband wasn't there, her friend was there, and they told her she couldn't keep down the blood thinners. And for her, that was a massive trigger because my thing was a blood clot. And she just lost it, like absolutely lost it. And I also remember when I was starting to get better, she also has something called PMR, which is not helped by stress. It's polymyalgia rheumatica. And she got a crazy rash all over her body when I was in ICU, and I actually think one of my doctors ended up helping her out, but it was bad and it manifested physically. So I think there's a huge amount of trauma on families. I don't know what the solution is. I think that being there, like my mother was there and Mark was not so much there. And they both seem equally traumatized. Yeah, it's a big deal for your family.
Yes, during those 9 months and almost 10 months, it was quite stressful, the situation for me, because I was traveling back and forth at the beginning from between London and Sunnybrook, Toronto. And my goal was to bring back Renee at home, but obviously his health was deteriorating. He got infection after infection. So every time there was a drawback, it was very stressful. Even if he passed the most critical period, they said the first 2 weeks when you have ARDS is the most critical. You have 50% of dying or surviving. And so I was, all the time it was go, go, go. Even on the highway, I was driving fast to go and arrive after work at Sunnybrook Hospital. And then I had to slow down because in the hospital the rhythm was different. Then when we transferred Renee from Toronto to London, also we were not sure that he would support the transfer. It was by airplane, ambulance airplane. And so, but here I received a lot of support from the staff, from the nurses, from the chief nurse. They realized that I was very stressed at one point and they asked me to leave the hospital for 1 week. So I went back and visited my family in France. They also suggested me to talk to a psychologist, and I say, why? But then talking to a professional about the problem that you are dealing every day during this period was kind of relief for me, because my parents, my family couldn't understand what I was going through. And the professional, actually, the psychologist at Victoria, was very helpful, and she could understand what I was going through. So it really helped me, plus having the support of the staff, knowing that I could count on them at night, and I was close to home, and every day was a new day to bring Renee back home. My objective, and I told the nurse, the chief nurse when I arrived, was to bring Renee home without any support, any ventilator, any tubes, and any oxygen if possible. And that's what we succeeded with their help. And I really appreciate. Also, the communication was key. I think the communication from the staff to the family and explaining every week what they were planning, their plan, and what they were doing, and the approach they took with the steroids to bring back Renee to anabolic state instead of catabolic, and the result it gave him was very helpful. So, and at the same time I was checking my diet, my exercise, and I was sleeping well at night. I was so tired during the day. I was working and being at the hospital, so it was 16 hours in between both. So those 8 hours of rest really helped me. And no, it was, I didn't have any nightmare. And even now, we still talk about it to prevent any post-traumatic disorder. We talk about his experience when he wants to know the details, when he was in the coma and stuff like this, what happened. And I think it's also a good way to relieve this stress. And when we come back to the hospital, because we are volunteering now at UH, it's not painful because we see the face of the nurses, and we are very happy to see them because they help us, and for me it was a kind of second family. And they like to see us again because they can see the result, even if the case of Renee was very critical when you arrived. And for them, it's hope that you should never say it's impossible. Everything is possible. I understand that there are some other cases that were not as good, I would say, as lucky. But in his case, the before and after was a big reward.
Just to add to that a little bit, I think it's for all the staff that have seen me come through. And like I said, when I told you there, I saw some people that had some doubts. I think it must be really gratifying to see that the work that they've done has paid off, and has paid off big dividends. I'm here, I'm alive. Also to talk about the family, the rest of my family, by the way, they're all in Quebec, and they were driving about 10 hours plus to come and visit me either at Sunnybrook when I was there, or up here in UH. And when I talk to them sometimes, like they shake their heads, and they can't believe the great work that was done, because they never expected me to ever get out of the hospital alive. So to them, it was probably hard as well. And I know Eve was keeping in touch with them to let them know what was happening, how I was doing. And it's not easy for some of them to be back in the hospital and to see me. Just of the 10 months that I was in the hospital, by the way, I just going to have to, I'll just give you the breakdown. I did 9 months and 1 week initially. Then I was out at home for 7 weeks. Then I was back in hospital for the last 3 weeks. Again, when I came back the second time, I went right into the ICU. And then I spent 1 week on the 4th floor recuperating before coming home each time. So even with the second time, that I came back in the hospital, they were really worried, and none of them came in, because Eve mentioned to them that no, I was doing fine, and that I was coming back out fairly quickly. So that was good.
Serena, I'll have Serena go, and then I just kind of wanted to acknowledge our time. I thought, well, maybe the most urgent question after this one, someone raise their hand really high, and then I think we'll probably close things off after that, okay? Sorry, Serena.
So I think traumatic experiences like these are pretty ingrained in the family's minds. From seeing what you look like, to the conversations, to the sounds the machines made, to news that you received. I think these are all pretty ingrained in our minds, and they tend to come out on the big days, like the 1-year anniversary, or the day you got discharged, the 1-year anniversary from that. But it's hard not to focus on like the good and all that came out of it. So like I'm here, and just the love and support that we got. And my family and I like to think that my guardian angels are within critical care. So we tend to go back to visit just to see our guardian angels. Because few actually can say that their guardian angels like are here and that they can actually meet them. So.
Thank you for your stories. I was just wondering, between the three of you, what was it like hearing each other's stories, and was there anything that resonated with you about someone else's story?
Yeah. So the first time that we actually heard our stories, she was so cute about it. She was like, "So everyone, can we all just see our trach scars?" And then we were all like, and it was like we were family.
Sorry, what was the question?
What resonated? What impacted their
It kind of broke my heart. Like I have to admit, when I first met you, I was like, damn it, someone has a better story than me. Which it's not, incidentally. It's a different story. They're just different. And then I said to Renee, I'm never gonna complain about 47 days again in my life. 10 months is ridiculous. So what resonates? What I love coming to terms with was, I was talking to Janet at Abel's birthday or something, and I said, you said to me, they never would have taken the chance on you unless they had had the success with me. So like if I'm the test case and then they can build from that, that's amazing. That's my favorite thing. Are you guys med students? Yeah. Keep up the good work. Yeah, it's just insane. It's really cool to meet people who have had similar experiences and to hear their take on it and similarities and differences. I don't know. It's really cool. It's actually really cool.
I think it's difficult when you don't know a lot of people that have gone through what you have or truly understand. And so there are similarities between our stories. So it was nice to know that there are other people who know exactly how you felt or who really get it, I think.
I think what I find very good on the first time we met, we were discussing a little bit of our situations, and we shared so many similar things. It was that to me just struck me a little bit, and I said to myself, I said, I thought I was alone on this. But it's not the case. I mean, like the situation we went through, for even if it's a shorter period of time, me was a long time. It took me a long time to get back up on my feet. There was perhaps complications that evolved as I was there. But I mean, like the underlying theme is we went through was very, very similar. And I think that was nice to hear and nice to see.
One of the things I was signaling to Janet, whether she wanted to add anything there, but one of the things that I heard in response to the question was just the element of advocacy. And I say it in part because of these three stories, but I say it in part because it's actually one of the things that happens every time we run this event is the power of advocacy from a family member or from the nursing staff. Nurses get talked about a lot in a very powerful way about their advocacy. And the protection and the communication, those are things that I heard a lot when we were sitting around my kitchen table. Anyway, I think for time's sake, I'd like to close things off and just acknowledge you all have your own lives and places to be. There is an opportunity to mingle in the lobby. We have refreshments and snacks. If anybody has their library card, you can go right across the hall before 9 o'clock and validate your parking if you parked underground for free. And I think that's all the housekeeping. I really want to thank you all for being here. Thank you for making this continue to happen because you show up. And I really, really want to thank all of you.